We have an update for you on medical experts who call out the negligence of a doctor. Doctors have now weighed in on the tragic story of Jessica Ross and Treveon Isaiah Taylor Sr. Young Georgia couple filed a lawsuit last week alleging their child was decapitated during delivery by a doctor who used too much force during traction. Have you ever heard of something like this? Just let that sit with you. Have you heard of something like this? All I can tell you is what came to mind was how Black young women were operated on without anesthesia, and that gave us modern day medicine and techniques today, gynecology. No anesthesia. Too much force, so much so that the child was decapitated. There's more. As we covered last Friday, the couple is now suing the Southern Regional Medical Center in Riverdale and the obstetrician, Dr. Tracey St. Julian, who is not employed by the hospital after she allegedly applied ridiculously excessive force trying to deliver the baby with shoulder dystocia. Okay? And I know that she's a Black woman. I also know that this institution that we're dealing with and the disparity in healthcare and everything else is just that. It is why we often see Black officers on certain scenes not protest or even engage in vile activity. It's why. St. Julian's alleged tremendously excessive tension traction on the head and neck of Ross's baby named Treveon Isaiah Jr. resulted in multiple skull and facial bone fractures and hemorrhaging on his neck and brain around his spinal cord, according to the suit. While Premier Women's OB/GYN St. Julian's practice did not immediately reply to requests for comment, Southern Regional Medical Center said in a statement that it denies the allegations of wrongdoing and that this unfortunate infant death occurred in utero prior to the delivery and decapitation. Hospital also said it voluntarily reported the death to the Clayton County Medical Examiner's Office and is cooperating with all investigations. The lawsuit says the couple was discouraged from getting an autopsy. The baby was already dead, nothing to see here in utero. You have got to be kidding me. You have got to be kidding me. How dumb do you think we are? How little feeling and love for our children do you think we have? Nothing to see here, no autopsy needed. You shouldn't get one. Well, there is more. We'll give you this recap. According to the lawsuit, Ross's water broke around 10 a.m., July 9th. She arrived at the hospital 10 minutes later. By 8:40 p.m., Ross was fully dilated and was instructed to push. However, the baby did not properly descend. Lawsuit says, most likely because of shoulder dystocia, which occurs when a baby's shoulder gets stuck behind the mother's pubic bone. NBC News with that reporting. Shoulder dystocia occurs in roughly 3% of vaginal deliveries. Typically happens to women who have reached full term, said Dr. Kiara King, an OB/GYN in Illinois, who is not involved in the case. You see the illustration there. Risk factors for shoulder dystocia include the mothers having diabetes or being short in stature. Ross, 20, had been diagnosed with type 2 diabetes in July 2022. Her pregnancy was considered high risk, the suit says. Another risk factor for shoulder dystocia would be whether the baby weighs more than 8 pounds, 13 ounces. According to the lawsuit, Ross's baby weighed 7 pounds, 6 ounces upon delivery. While doctors are able to point out possible risk factors, shoulder dystocia is not something that we can fully predict, Dr. King said. King mentioned that in her deliveries, risk factors like diabetes and a larger baby would typically prompt her to offer a couple a primary C-section with a goal of ideally preventing a shoulder dystocia. as per guidelines set out by the American College of Obstetrician Gynecologists. Dr. Joya Creer-Perry, OBGYN and founder of the National Birth Equity Collaborative, said that even in the moment, the doctor, the nurses, and other staff members should have agreed that the patient was deserving of a C-section. They could have changed course here, folks. You have to be agile and know what's going on and react accordingly, adapt a different strategy here to deliver a safe, healthy baby and keep the mother alive. No pivot. Creer-Perry said she has used instruments like forceps and vacuums to help patients with the pushing, but that if they prove unsuccessful, C-sections are ordered. Dr. Creer-Perry was not involved in the case either. Dr. Roderick Edmond, one of the couple's attorneys, said nurses and other healthcare providers should have had protocols to deal with the problem. Ross and Taylor, 21, asked for a cesarean section while the baby was viable, Edmond said. Instead, Ross pushed for 3 hours without delivering her baby, the suit says. And St. Julian tried to deliver it vaginally using different methods, one of which included applying traction to the baby's head. According to the lawsuit, fetal monitors showed an abnormal fetal heartbeat starting at 9:26 p.m. The heart rate continued to decrease until 10:36 p.m. There was no sign of a fetal heartbeat on the monitoring strips by the time St. Julian performed an emergency C-section at 11:49 p.m. More than in 2 hours after that heartbeat started to become abnormal. Baby's body was delivered at 12:11 a.m. 2020, the infant mortality rate during delivery in the US, 5.4 deaths for every 1,000 live births, according to the Centers for Disease Control and Prevention. Additional data shows the rate was highest amongst Black babies, 10.6 deaths per 1,000, nearly double. While the way Ross's baby died is incredibly rare, can happen. They don't typically, King said. Family is seeking an undisclosed amount in damages for the baby's life, along with Ross's physical, mental, emotional pain and suffering, according to the suit. Since the incident, Edmond said the couple been in bad shape and are attending counseling because they have been psychologically traumatized. Millicent Rose, a trauma specialist, professor of clinical psychology at Pepperdine University, said, with medical trauma, we're really mindful that one of the things that can compound onto symptoms is when we know that it could have been preventable. It occurs due to negligence or at the hands of another person. Holding a child after birth is a rite of passage for any mother, fathers too. Robbing mothers of that opportunity after loss can cause prolonged grief. Central nervous system interaction between mother and child is necessary for the mother's healing, regardless of whether the child survived birth, she added. The couple said in the lawsuit they were unable to hold their baby. The hospital did not address why in its statement. This is so sad. It's pathetic, but it's emotional. I'm a mother. This scenario where the heartbeat was going down, I could not deliver. I needed a C-section, and I had a great doctor who cared, Dr. Svets, who after a certain point, I wanted a vaginal delivery. That's what I wanted. She said, Sharon, we gotta get this beautiful baby out. It's gonna be fine. Let's go now. A doctor doing what she was supposed to do. She had a team standing by in that emergency room to tackle any problem my daughter had. A great doctor, helping out at the time, a news lady in that city. This is what happens every day, Mayor. It is despicable. I can't imagine what they're going through, but this is so real. It's real.
Yeah, it's real, and it's so much to unpack in this story. The history of how Black people have been mistreated, malaligned with our medical system, and people wonder why there's so many unbelievable Black people, people who don't trust the medical system or the healthcare system in this country. And then you hear a story like this. The idea, if you just look at the time logs in those stories that you were reading, the idea that it took them 10 minutes after their water broke to get to the hospital, that showed the due diligence and the readiness of them to have this child, right? But then they get to the hospital and they are forced to push for 3 hours, they being the mother forced to push for 3 hours when the C-section only took 20 some minutes. You could have saved this baby life and had that baby in the world from 9:20 to by 10 o'clock, that baby could have been in this world. Instead, you pushed and pulled on this child's neck so much that you decapitated that child. Then that wasn't enough. You did something even more disgusting. You discouraged this family from seeing the child. You didn't let them hold the child, and you try to convince them that they needed to cremate their baby that you had just decapitated. There's so much wrong with this, and the fact that there is a Black body that was responsible for delivering this baby of this Black woman speaks exactly to what you talked about, how white supremacy functioned because of Black silence. There's always been Black people willing to sit silent on Black trauma and carry on the banner and moniker of white supremacy. And this is an example of that. And it is sad that this young couple lost their child in this manner when they did everything side by side. They did everything they were supposed to do to deliver this child. And we see the negligence of this hospital, this doctor, and everybody in that room that allowed that child's heartbeat to slowly dissipate to the point that there was no life left. For over an hour, you watched that happen, and you decided to do a C-section after.
You were losing the baby, not all at once. It feels like, Mayor, they didn't matter. They were pleading, these 21-year-olds. Can we have a C-section, please? Why are you? I need to know the other circumstances here, because not just the Black body, the doctor. Who else was in the room? Did someone not want to go to the ER with someone at dinner? What's the reason here? If we've done stories that C-sections happen too often and they should be discouraged planning around and doing that kind of thing, this wasn't that case. I am heartbroken. It's not just a child gone, the method, the manner, the suffering. It's horrific. The parents left behind who need counseling. It's just horrific, Mayor. I'll give you the last word.
No, I mean, you're right. It's horrific. I'm at a loss of words. And I think, this story, I think you did a great job explaining what it means. I can't give birth to a child, and there's no need for me to mansplain the pain. It's just the human nature of how disgusting this story is that bothers me.
Junior, the father's hurting too. We'll keep following the story, the family's lawsuit.